Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. The Verbal Fluency Test for Dementia Screening. The Verbal Fluency Test, VFT, is a short screening test that evaluates cognitive function. It's often used by physicians and other practitioners if there is some concern that the person may have Alzheimer's or another type of dementia. /r/n/r/n by its name, you might guess that the test has something to do with speaking and speed, and you would be correct. The test consists of giving the person 60 seconds to verbally list as many things as possible in a category. Practitioners often use the verbal fluency test in two different ways. /r/n/r/n the person is asked to list all of the animals he can think of in the next 60 seconds. Some variations include asking the test taker to list all of the fruits, vegetables or the professions he can think of in 60 seconds. /r/n/r/n in the phonetic subtest, a letter is chosen by the test administrator and the person is asked to name all of the words that begin with that particular letter. The most common letters chosen are F, A, and S. Some clinicians will have the individual do a 60-second test on each letter, and others will just choose one letter. /r/n/r/n to score the VFT, count up the total number of animals or words that the individual is able to produce. Norms for the scoring are based on age and education for each test. /r/n/r/n research has shown that the semantic VFT, in particular, is comparable to both the MMSE and the Clinical Dementia Rating scores, two other tests frequently used in cognitive testing. The semantic subtest has also been shown to be quite effective in measuring executive functioning and language ability. This may be because the semantic/category subtest seems to require a higher level of thought processes since people have to think of meaning rather than just beginning sounds of words. /r/n/r/n the phonetic subtest does not appear as sensitive to the early stages of dementia. However, the test results as people age are quite stable, making it a valuable tool. If someone scores poorly on the phonetic subtest, it is quite likely an indicator of cognitive decline rather than older age. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.